How to recognize the early symptoms of tuberculosis. Recognizing the early symptoms of tuberculosis, often referred to as TB, is essential for timely diagnosis and treatment. TB primarily affects the lungs, known as pulmonary TB, but can also impact other parts of the body. The symptoms tend to develop gradually, so being aware of the warning signs is crucial. One of the first symptoms to look for is a persistent cough that lasts 3 weeks or longer. Initially, this cough may be dry, but it can progress to produce sputum, which is phlegm and, in some cases, even blood. If you notice this change, it is important to pay attention. Chest pain is another symptom that may arise. This discomfort can worsen when you cough or take deep breaths. If you experience this pain alongside a cough, it is worth discussing with a healthcare professional. Fatigue or weakness is also common in the early stages of TB. This feeling of tiredness does not improve with rest and can be quite concerning. Many people may overlook this symptom, but it is a significant indicator. Unexplained weight loss and a loss of appetite can occur as well. If you find that you are losing weight without trying and do not feel like eating, these changes should not be ignored. Fever and chills are also symptoms to be aware of. A low-grade fever that comes and goes, sometimes accompanied by chills, can indicate an underlying issue. Night sweats are another hallmark of TB. If you experience excessive sweating during sleep that soaks your clothing and bedding, it could be a sign of TB. These symptoms can develop over weeks and may initially be mistaken for other illnesses. It is important to note that individuals with latent TB infection do not show symptoms and cannot spread the disease. However, they can develop active TB later if left untreated. TB can also affect other parts of the body, leading to specific symptoms. For instance, swelling of lymph nodes can occur, presenting as from lumps under the skin. If TB affects the kidneys, you might notice blood in your urine. Spinal TB can cause back pain, while TB in the larynx may lead to hoarseness. In more severe cases, TB meningitis can result in headaches or confusion. If you experience any of these symptoms, especially if you have risk factors such as recent exposure to TB, living in or traveling to areas with high TB rates, or having a weakened immune system, it is crucial to seek medical evaluation promptly. Early diagnosis and treatment are essential to prevent the progression of the disease and its transmission. In summary, recognizing early TB symptoms involves being alert to a persistent cough lasting 3 weeks or more, chest pain, coughing up blood or sputum, fatigue, weight loss, fever, chills, and night sweats. Additionally, be aware of symptoms related to TB in other parts of the body. Consulting a healthcare professional is vital for accurate diagnosis and appropriate care.